Hello and welcome everybody. I'm Anthony Gonzalez and I'm the program coordinator for the Higher Education Center for Alcohol and Drug Misuse Prevention and Recovery. I want to welcome you all today to our webinar titled Moving Beyond Orientation, Increasing Engagement of Parents and Families as Partners in Reducing Substance Use Among College Students, featuring Dr. Malinda Kennedy and Kelsey O'Hara. Before we get started with today's session, I do just have a couple of housekeeping slides I'd like to share with everybody. Here on the screen should look somewhat familiar as we are in the Zoom webinar format. We do welcome your questions at any time throughout today's session for our presenters, but we do kindly ask that you utilize the Q&A feature. We do have the chat enabled, so please feel free to share who you are and where you're joining us from, along with reflections and resources as it pertains to the presented content. But again, please utilize the Q&A feature for any specific questions you may have. We have captioning enabled, and you should be able to turn that on through your bottom dashboard. If you have any issues getting that set up, please send me a chat and I will try my best to help you through that process. We also encourage everybody to learn more about becoming a member of the Higher Education Center. You can learn more about the different membership tiers and the benefits that go along with them by visiting our website at hacaod.osu.edu. We also have a couple of upcoming events that I'd like to share with everybody. Our next session in our Spring Learning Collaborative is taking place next week on March 6th, and it's titled Nurturing Connections and Interpersonal Strategies to address Non-Medical Prescription Drug Use on College Campuses. We also have a water cooler chat on March 12th, and that topic will be around strategies for promoting safe prescription medication practices. We also have a webinar taking place at the end of March and is titled Harm Reduction in the Collegiate Setting, Implementing Practical Evidence-Based Programs and Policies. And we also have the 2024 National Meeting taking place here in Columbus with a simultaneous virtual offering happening July 30th through August 1st. Registration is now open, so you can learn more by visiting our website. And with that, it is my great pleasure to introduce you today our two presenters, Dr. Malinda Kennedy, Project Director with the Maryland Collaborative, and Kelsey O'Hara, Training and Technical Assistant Coordinator with the Maryland Collaborative. It is a pleasure having you both, and at this time, it's my pleasure turning it over to you.
Thank you so much, Anthony. Good afternoon, everyone. We're very happy to be here today with you. As Anthony mentioned, I'm Malinda Kennedy, and I'm here with my colleague, Kelsey O'Hara. And we are going to talk to you today about increasing engagement of parents and families. Next slide, Kelsey. This is just a little overview of what we'll talk about today. Next slide. So I thought I'd just start a little bit with a little bit of information about us. We are both with the Center on Young Adult Health and Development at the University of Maryland, College Park's School of Public Health. Next slide. We work predominantly on the Maryland Collaborative Project, and this is an initiative funded in 2012 by the Maryland Department of Health to reduce excessive drinking, substance use, and related harms. We provide resources, technical assistance, trainings, and policy recommendations to our member schools using evidence-based strategies. And we also do an annual survey of students in order to monitor progress and trends. So today we're going to talk a little bit about our work to engage families and parents. And first, I'll start off just to orient us all as to why we would engage with parents related to substance use. I'll give a little background about the research on parent engagement and substance use, and then Kelsey will dive in to the details of how we've engaged parents or tried to and what we've learned. So first, when we talk about engaging parents as partners, who are the stakeholders? Well, we start with parents, and a few decades ago, we had really probably one main advocacy group. You may remember MAD, Moms Against Drunk Driving, but that related to substance use. But now there's a lot of other advocacy groups that are parent-based, often, unfortunately, that emerge from tragedies. But in addition to that, there are just parents want to be involved in their college experience of their students. And in terms of higher ed, we've really seen family engagement grow in the last 20 years. And this is not just the number of programs, but the amount of resources and outreach that all those programs do has also expanded tremendously. And then finally, we have the students themselves. And generally speaking, compared to previous generations, they are very close to their families and parents and value those relationships and want to maintain them. Next slide. So I think it's also important to say that with all the struggles of loneliness and isolation that students are feeling today, it just makes sense to support and maintain any key connections and supportive relationships that these students have. It's good for everybody to keep those connections in place that so support the students. Next slide. So not only are students close to their family and parents, but they also report that they trust them as a source of health information. This is unpublished data from our Maryland Collaborative, and it supports data, other published data that shows this, that students believe their families are a source of trustworthy information. So we want to make sure that when students go to their parents, the parents are armed with good information to pass along to their students. Next slide. So how else do parents influence students? I'm going to quickly highlight a few studies on this topic, and I encourage you to look more closely at them if you feel so inclined. So Abar and colleagues have done a lot of work in this area, and when they looked at parent messaging around substance use, they found that it was really the no alcohol messaging that was most protective for college alcohol use and consequences. And that other types of messaging, such as harm reduction or a mixed messaging, really still resulted in some risk to students. Next slide. And along those same lines, in the Maryland Collaborative data, when we examined college students in the lowest alcohol risk group, we found that most of them reported their parents had not allowed them to use alcohol at all in high school. So that's 83% of those students in that low risk group were not allowed any alcohol in high school. So this limit setting is another important aspect that can carry over and be important in college as well. On the flip side of that, parents just giving the perception of permissiveness, even if they are cannabis use. And again, this slide is from Maryland Collaborative data. And in this graph, the blue bars on the left show that a higher proportion of binge drinkers reported their parents not minding if they drank compared to the non-binge drinkers. And on the right side, you'll see that with cannabis, we found a higher proportion of students who did not use cannabis said their parents disapproved of any cannabis use compared with students who did use cannabis. And this is similar. 2019 Mallet study had similar findings. They found that parental permissiveness was not only associated with drinking in the first year of college, but also in the fourth year of college. Next slide, please. And as I mentioned before, Abar and colleagues have examined many aspects of parental influence on college drinking. And to quickly run through some of their other findings, their 2008 study found that students who reported parental monitoring and parental disapproval of alcohol use were more likely in college to choose low alcohol use friends, and that led to their own lower alcohol use. And then in 2012, they found that students who had a parent with a pro-alcohol profile had a probability of being a high-risk drinker that was more than 3 times that of students whose parents fit one of these other 3 low-risk profile groups. And they followed this up in 2014 with the longitudinal study. And again, they found that students with pro-alcohol parents had a steeper increase in both typical weekend drinking and heavy episodic drinking compared with students whose parents fit these other profile groups. And then finally, I thought this 2023 Traeger study was interesting and important to highlight. This study found that students who reported decreases in parent-student calls and texts in their first month of college had increased alcohol use and consequences in their second semester compared to those students whose communications either increased or stayed the same with their parents. And again, just this illustrates how important it is to maintain this connection between students and families and how it can reduce student risk. So just more reasons to keep this family communication flowing. I'd also like to touch on mental health because we're all very aware of the high rates of mental health conditions on with students on campuses today. We know that students who are depressed are much more likely to have alcohol use and related consequences, and we found a similar pattern in Maryland Collaborative data. So, for example, we find that for students without any mental health condition, diagnosed mental health condition, the prevalence of binge drinking was 22%. However, when we look at the prevalence of binge drinking among students with any of these variety of mental health conditions, you'll see that the prevalence is much higher in those groups. And then similarly with cannabis use, we see for students without mental health conditions, we see a much lower prevalence of cannabis use compared to students with any of these mental health conditions. So can parents, next slide, please. Can parents make a difference with these more vulnerable students? And Geisner and Morgan have each looked at this, and the answer they found was yes, they can. So Geisner found in 2018 that for students with depressive symptoms, parental monitoring reduced their negative alcohol consequences. And Morgan found that the perception by students of an alcohol-related discipline by their parents reduced their alcohol use and also subsequently their negative consequences from that alcohol use. So for these students who are more vulnerable and already dealing with so much, this parental influence remains important and could really reduce additional stresses and harmful behaviors and outcomes that these students could experience. And lastly, if you're wondering what's an example of a parent intervention, I'll share with you this 2023 intervention by Hill. This was a randomized control efficacy trial, and they provided handbooks to parents before students matriculated. These handbooks contained a variety of information related to substance use, how to talk with students about various topics, including substance use, and then also other information that was just more related to general information relevant for college success. And they found that both alcohol and cannabis use was lower among the group of students whose parents received the handbooks compared to the group of students whose parents did not get those handbooks. And so to summarize, parental influence is relevant for college substance use and comes in a variety of forms. And even though they're not together physically with their students, parents really remain a source of information and support and can be crucial partners in our work. So if we can find ways to maintain and supportive and productive communications between parents and students, we could leverage this influence on college students by developing and implementing parent-based interventions and really work together with parents to reduce the risk related to alcohol use. So that's just my part to kind of orient us as we move into the next segment with Kelsey, where she's going to share some of the specifics of what we've done with the Maryland Collaborative. Thanks.
Thanks, Malinda. Yeah, so we're going to shift gears a little bit and kind of shift into talking about implementation, but also discuss from parents themselves what they say they need and what would be helpful. And like Melinda mentioned, we'll talk a little bit about work that we've done. So just as we might, as practitioners and those in higher education, experience barriers on our professional side engaging with parents, parents themselves also have barriers too. They're certainly susceptible to the same sorts of societal expectations of college that our students are. So they might come into the experience kind of imagining substance use as kind of inevitable or a normal part of the experience. Or what we see a lot is feeling kind of disempowered, that they don't really have an influence over their students' choices once they leave for college. We certainly also compete for parent attention, and they have a lot on their plate. So it's natural that perhaps our topics don't fall to the top of their priority list after things like housing and financial concerns and just a lot of logistical things that they need to handle alongside their student at the beginning of college and throughout. And they also receive a lot of mixed messages in terms of kind of communication strategies and when to step in and when to step back. And I would say these mixed messages come from a variety of sources. It could be from fellow parents, it could be just kind of societal norms, but I'll also discuss that sometimes our institutions themselves provide them some mixed messages about what sorts of communication strategies are best. So they have to kind of wade through all of these different factors. They also have some stereotypes to contend with, certainly. So in the 2000s, we saw the rise of kind of the helicopter parent stereotype. So referring to parents that are kind of always hovering and ready to swoop down the minute something goes wrong. We also see a little bit more recently mentions of bulldozer parents or so-called snowplow parents. So kind of taking that helicopter idea a step further by kind of trying to plow ahead and eliminate any obstacles or sources of distress from the path of their student before they would have to experience them. And then on the other side of the spectrum, we see mentions of free range parenting. So parents who might emphasize that their students should experience kind of natural consequences of choices that they make. And so what we would say in terms of substance use prevention and parents is really none of these fit exactly what we know to be best. There are pieces of each of them, certainly, that really shouldn't be thrown out, though. I mean, obviously, we want parents to be able to recognize when their students in distress and feel ready to step in, perhaps without the hovering. And we also want students to feel a sense of autonomy. So it really is a balance, and parents feel this challenge for sure. So Harper and colleagues did a study where they observed lots of different orientation programs across many institutions and also did interviews with family orientation staff just to get a full picture of the type of messages that parents are receiving and what parent and family engagement staff would ideally like parents to receive as the ideal communication strategies and amounts. So if we kind of take the analogy of this bicycle, we don't want students like on the left feeling like they're bicycling through, deep water by themselves and that they just have to muscle through things without getting support. At the same time, we also don't want parents driving the bicycle and the students just in the back seat. We know that that's not best for their learning either. What Harper discusses is really this kind of metaphor and this Goldilocks principle of finding the just right amount, which is kind of like going on a bike ride alongside their student and their student kind of leading the way, but they're certainly there for support and guidance more in sort of a coaching role, but that they certainly still are available for support and have an influence over their student, and they're not hands off or too much. So I'm going to talk a little bit about some focus groups that were done close to the beginning of the collaborative. So the collaborative started in 2012. That was prior to Melinda and I's arrival on the collaborative, but they did a lot of great work that I want to make sure we share because very quickly the collaborative identified parents as a really high impact audience that needed to be engaged around these topics, wanted to take some time to understand where they were coming from. So some themes that they noted was parents just kind of struggling with feeling in the loop. So First, as I mentioned, they also noted having this difficulty reaching a balance. They recognize certainly the importance of letting their student be independent and having a sense of autonomy, but at the same time, they also noted wanting to know what's going on in their student's life daily. So those are definitely two kind of opposing goals that they realized they kind of had to navigate. They also mentioned really feeling kind of out of the loop with what's happening on campus. They wanted to know really the nitty gritty, what are the trends in alcohol and substance use that their student might realistically encounter. And so they felt that without knowing, they couldn't really adequately prepare their student or talk to their student prior to coming to campus. And then if they didn't really know, after they went to campus, they didn't know what to ask about. Many were really not aware if and how much their student drank. There was a continuum of attitudes regarding kind of permissiveness or a level of concern over if their student used or how much, but by and large, there was not a great awareness of the level of consumption, if any, from their student. So just a feeling a little bit of disconnection. Another theme certainly were some frustrations that were brought up. These centered around what probably many practitioners here wouldn't be surprised at is things that they felt the school should be doing but isn't doing, or maybe isn't doing enough of, or maybe they aren't aware that they're doing. The good news is, though, that the things that they were asking for, most of which were really in line actually with evidence-based things that we know would be positive practices. So that's really great that they're actually already thinking along those same lines. One encouraging thing that they mentioned, and this was done a little bit over 10 years ago, was they recognized a greater need for students that struggle with substance use, which made me excited to read as kind of a former practitioner in this field, because I know that since then there's really been kind of an explosion in recovery programming and resources. So I felt good reading that, like we've met that identified need. So that's really great. Another thing that they mentioned was that they wish that their school either had more non-drinking alternatives or at least promoted them more, which I thought was really great. That's something that I know many of our campuses do really well. And, even if it's not on-campus activities, there's lots of different community opportunities that students can engage with that don't have anything to do with substance use. But thinking back to times when, like, I presented at orientation and I was reading this feedback, I was like, wow, I really wish that I had kind of highlighted that a bit more. It's not something that came to the top of my mind, but I just thought that was definitely important to mention. They also did express some frustration towards other parents. So parents that their students, parents of students that their child was already interacting with, perhaps being more permissive. So kind of not being in line with what their expectations were. They also worried about parent drinking itself and kind of the message that sends. And they also noted that many family weekend events actually included alcohol. And so they talked a lot about overall this concern around a permissive environment, and they recognize that really does influence their students' choices. Something that I think was really notable and something that feels actionable to me would be that they noted not really knowing or understanding the school's policies around substance use, and especially expressing concern around under enforcement, which I thought was really interesting. They recognized that if students didn't perceive there to be consequences, that really creates kind of a permissive environment that puts their students at a greater risk. And so they really expressed a desire to want the school to back them up when it came to enforcement of rules and expectations that they also had for their student. So I also found this really enlightening reading it back and reflecting on my prior experience because, other than kind of engaging with parents at orientation, I would say throughout the academic year, when I was a practitioner, we would often kind of hear from parents in the context of phone calls because our office did process some conduct referrals regarding substance use. And so typically the calls we got from parents were not, thank you so much for finding my student in violation of conduct, right? That would be great if they would call and thank us. But sometimes it was frustration, maybe like why their student got in trouble or they didn't really see why it was such a big deal. And so reading this was really encouraging to me because I realized I had a little bit of a misperception about the level of support for policy, and that parents really are invested in not having a permissive environment. So just a few themes to share there. So after the focus groups in 2015, the collaborative took all of that input, as well as things that parents identified that they really wanted in terms of resources, and created the collegeparentsmatter.org website, which is available and public for you to access today. We did a little redesign last summer, and so we're in the process of updating content and doing edits. But really, by and large, these themes still ring true. We took the topics that parents identified as challenging for them, and also structured the resources in a way that they said would be helpful for them. So as an example, we took pages to really focus on various high-risk topics. So events like spring break and 21st birthdays, alcohol holidays like Halloween, but we also talked about maybe some other contexts that they wouldn't necessarily think of as a time for higher risk. So as an example, when students move off campus, that environment in general can be associated with a bit more drinking, high risk drinking, than living on campus. So that was an important transition point that we wanted parents to know about so they can have conversations with their students. So these pages are kind of structured up at the top with evidence-based information and background about why that topic matters and why it's important, and the latest research regarding it. But then the majority really is focused on direct tips and actual examples of things that parents can say. That's what they really identified. They wanted concrete examples of conversations that they can have and prompts that they can put into practice. We also include some tips about things maybe to avoid saying too. So some examples of this is, sometimes parents might have the well-intentioned idea to kind of share quote unquote like war stories with their students, to try to share some bad experiences that they maybe had in college or as a young adult, in the hopes that their student might be able to avoid those. And so as an example, we kind of talk through why this kind of well-intentioned strategy actually might backfire a bit, and unintentionally kind of normalize that behavior. So we talk through some misperceptions that parents sometimes have as well. We cover tips for good communication in general, and also provide evidence-based answers to some frequently asked questions. So questions like, can I teach my student to drink responsibly? Or I've never spoken to my student about alcohol. Is it too late? And of course, the answer is no. Really, the focus of the website is to boost parents' confidence and really empower them to have conversations, because as Malinda talked about, we know that they're so influential, and oftentimes they don't know that, or they don't know how influential they are. So if we can just give them the tools in which to feel more confident to have these conversations, they can be really impactful. We also have conversational prompts that parents can use like throughout the year. So different times that kind of would require different types of conversations to happen, such as over winter break and things like that. In the fall of 2021, we started a quarterly email newsletter, which has been really exciting to see grow. So, of course, the website was always there for parents to go back and reference, but we wanted a way to continually engage with parents and also bring them up-to-date topics, things that are happening on college campuses that are being talked about in the news, and relate them to the topics that we talk about. So as an example, here on the left of some screenshots of our fall quarterly newsletter from 2022. So that was the first fall that felt a little bit more normal. So students were by and large back on campus in person. So in each of these newsletters, we do feature a page or more from the website, but we also take kind of timely topics and talk about them in a broad sense, but then also relate them to substance use. So for example, in this newsletter, we talked about how to navigate social anxiety and how social anxiety can relate to substance use. So we incorporated that. I'm also always on the lookout for other resources. So listen to lots of podcasts and read articles. So we also will link out to other things as well. We have a nice little archive going now because we've had the newsletter going for a few years. So definitely encourage you or any parents that you work with to check that out, because they kind of function as like mini articles. And you're also welcome and really encouraged to subscribe to our newsletter. A lot of our subscribers are also campus professionals. We have a variety. So we have current college parents, of course. We do have future college parents that subscribe, and we also have education professionals. So we've been really excited about the growth of this, and it really ties into some of what the parent and family engagement profession is seeing in terms of requests for engagement, which I'll talk about in a little bit. Before the newsletter, we did have a small subscription list that was signed up. They could sign up if they wanted to just be notified when we put out new content. Since we started the newsletter, though, that subscription base has grown almost sixfold. So there's definitely an interest in this content, and parents are ready to receive it. We do get good open rates, so we average now, and it continues to rise as we do more newsletters, around 55 to 60% open rate. So we're really happy with the newsletter, and it's something free and something plug and play that you all are welcome to use as well if it's helpful. So with the Maryland Collaborative, we provide technical assistance to our 19 campuses, and included in that are other types of parent resources that we develop. So for example, I did talk a little bit about conversation prompts. So we have like a seasonal checklist that parents can use. And this printable is actually available on the College Parents Matter website as well. We also have resource roadmaps. Each of our schools gets one of those. So with kind of the rising awareness of health and wellness topics on campus, we've had resources increase, and there's lots of different types of offices, more than what parents might be aware of. And so that is amazing, but also requires maybe some information to navigate. So for each of our schools, we outline different types of concerns that their student might encounter, and then link them to the appropriate office so that parents can have an idea of where to refer their student when they come to them with different struggles. We've also done like a similar concept for incoming college parents, just to give them an idea of the types of resources that are offered on college campuses. And then we also do webinars for parents. So we have done really broad ones just around substance use in general, but also specifically about cannabis. And then last but not least, we also have written like custom letters that are kind of plug and play. So already worded in the way that we know is evidence-based, to share out information that vice presidents of student affairs or other administrators can use to email out to parents or put in a parent portal, for example. All right, so I'm going to shift gears again and just talk a little bit about some implementation ideas for you all, and then definitely talk through some barriers, certainly as well, and just some possible future directions. So as someone that's a former practitioner, I do understand that it can be really challenging to get into orientation programming and to engage with parents, even with an amazing, relationship with parent and family engagement staff. Sometimes you really don't have any access or very little access, or probably what realistically happens a lot is you get a 5 to 10 minute spot at orientation, and that's a lot of information you want to share out in that bit of time, and at the same time you're kind of again competing for attention. And so sometimes it then feels like engagement opportunities that you want to provide to parents have to feel maybe like a lighter lift in order to have them opt in. And then certainly I've encountered kind of the not my student mindset. So parents that might not be averse necessarily to the information, but might not really be engaging with it because they just don't ever think their student might need that. And so they don't realize that they need to have that information until their student might already be struggling. And then certainly there are a lot of existing student programming needs that can stretch our capacity. So I wanted to touch on that briefly, just to say that when that feeling is happening, I think it's hard sometimes to think of adding like an entirely new audience, or at least expanding into another audience. But with parents, we really also want to empower you all to see them as a high impact audience, because they are such an upstream approach that it really can pay off dividends in your goals and for the well-being of your students if you can engage them early. So hopefully we can propose some different ways that could happen that feel like a little bit more doable. So this past fall, I was really excited to have the opportunity to go to a conference that was kind of outside my normal professional organization. Like I always find that interesting to hear like what other professionals talk about. And so how nice of AHEP, which is the professional organization for parent and family engagement professionals, to have their annual conference right here in Baltimore, Maryland. So it was local and I was able to go as kind of an observer, which was really helpful because I always want to make sure that the resources we're making are not only evidence-based and that they're helpful to parents, but they're actually realistic things that family engagement staff would be willing to include in the resources that they give out. So I did just want to talk through some themes that I noticed that I thought might be of interest. So one of them that I heard a lot was just the fact that family engagement professionals outside of orientation and that general orientation family weekend season also are continually getting a lot of calls from parents worried about their student, to the point that sometimes they're almost kind of functioning like a crisis manager, getting calls on Friday afternoons at 4 o'clock with students that don't have housing, that something has happened. And so they have to serve as kind of this referral source or crisis manager. And, thinking back to being a practitioner, my immediate thought when I was hearing these stories was like, well, parent and family engagement's not the number one office, that maybe should go to like a dean of students or housing and residence life. But then I realized, well, these offices are probably the first contact that a lot of parents have. And so it's natural that they're going to go there first. And so parent and family engagement offices are really fielding a lot of these concerns from parents. I really was excited to hear about some broadening mental health offerings that the field is doing. So I heard things like QPR being offered to families and actually facilitated by college parents themselves, which I thought was really cool, as well as worksheets that families can work on with their student to kind of make a distress plan ahead of time. I didn't hear as much about alcohol and other drug use, but what I was thinking was if we can hear about mental health and there's an interest there, then that can be a bridge for us because we know that it's so interrelated with substance use that perhaps we can try to make that connection. That can be a growing area of collaboration with parent and family engagement. Again, kind of hearing that same theme that we heard from the focus groups and from the parents that we continue to hear from through like the Contact Us forum on College Parents Matter, is that parents really want concrete recommendations and scripts, things that they can look out for to know if their student is struggling and when to reach out. So parents really are hungry for that advice, which is great that they want to know that. I think in every single session I went to, I heard a desire to partner more with campus departments. And specifically, I heard several times wanting to partner with health and counseling staff, which was great. They certainly talked about wanting to understand what to focus on and how to phrase things. But I also did hear some hesitancy, which I thought was just an interesting barrier that I would want to bring here because they did note that they knew that their health and counseling colleagues were really sometimes overwhelmed, that there's capacity concerns. And so I did hear a little bit of hesitancy sometimes to reach out to ask more of them when they already know how much they have on their plate. So thought that was interesting. And then just looking into AHEP a little bit more as an organization, I came across a report that they did in 2017 that outlined a lot of recommendations for the future of the family engagement profession. And several of them stuck out to me as things that could be incorporated into some sort of partnership or more touch points with parents on alcohol and other drug issues. So they definitely called for having more virtual content. So seeing orientation, the in-person 1 to 2 day is a great anchor, but not having orientation stop there. So having more virtual content, webinars, articles, things like that, that really also were distributed throughout the student life cycle. So not only focusing on that narrow time frame before students get to campus. There was definitely a call for more health and wellness information incorporated into these sorts of sessions, and also moving away from having maybe strictly kind of lecture-based sessions where we're presenting resources to having more interactive ones where there's some modeling of conversations, and even thinking about having more sessions where students and parents attend together, rather than kind of the traditional, once they arrive at our campus for orientation, we separate them out into their own sessions, but that it could be really productive to actually talk through some difficult conversations, including around drugs and alcohol. And also just encouraging more discussion of what constitutes kind of appropriate levels of communication, and with this new transition, what the parent-student relationship can look like. And I would say overall, my biggest takeaway from engaging at the conference and reading their resources was that just like we have a different kind of day-to-day reality when it comes to our thoughts about what parents need and want, for our family engagement professionals, they're likely, most engaging with parents that are concerned, that are the squeaky wheel parents that call and, are really well-intentioned, but want to make sure that everything's okay, and they're very active. So their perception could be that they want parents to learn how to step back more, which is actually a little bit perhaps in opposition to what Malinda and I are suggesting, in that in this context, we need parents to step in a greater way. So there could be just a good productive place for discussion there, where you can talk to family engagement staff about nuances, and knowing that they are professionals in communicating with parents, find a way to outline for parents what that balance should look like. I also wanted to share some data from Campus ESP. So if you're not familiar with them, they are a large technology platform that's used by a lot of parent and family engagement offices. So primarily for the purposes of running like a parent portal that families can access. They are, at many different campuses, over 350 colleges. They engage with over 9 million families. So their data I thought was pretty interesting. So they annually gather engagement data from the resources that they put out on their platforms, but they also conduct a user survey. So from a Campus ESP survey of over 21,000 current college parents, there is a huge interest in receiving very frequent communication. So 85% of families saying they want communication from their student's institution weekly or more. So when I read that, I was a little stressed out for our parent and family engagement colleagues. Like, wow, that's a lot of content they might feel a little bit pressured to put out. But I was thinking, well, maybe that's an avenue, because if they are in need of content and our plates are full, but we might be able to provide kind of passive resources and articles and write-ups, then that might be a good match that we can provide just to start that engagement process with parents. And, email is a preferred method. So if they're okay, digesting things passively, maybe that is more doable. And I think that could be a little bit of a perspective shift. We think of students, we often think, they don't open their emails, or we don't want to contact them too much, or else they'll just tune out. But perhaps our mindset just needs to shift a little bit with parents, because it seems like they really can't get enough communication. They're hungry for that information. And just to kind of underline the closeness of this generation that Malinda talked about, I thought it was interesting in the survey, 61% of parents said that they also have their students' college ID and password. So parents and students are connected, they're talking. That's not as much a barrier as we want to give them the tools of which to talk about, which parents do seem ready to receive. So that's great news. So some other opportunities and ideas for implementation. So if orientation just feels too crowded, I do just recommend taking advantage of kind of off-season times. There's lots of different transitional opportunities that we tend to target actually with the quarterly newsletter. So times when parents are expecting students to come home. So Thanksgiving break, spring break, winter break, things like that, where parents might be in that mode of thinking, okay, I want to check in with my student, want to know what to ask them about. They might be really receptive to receiving information from us at those times as well. And then in addition to orientation or any other engagement, or perhaps in place of it, if that's just a barrier right now, you could think about just saturating the parent environment in general. So if we can arm professionals that already are in communication with parents and give them the accurate information and let them know when they should refer or signs to look for that their parents talking about concern over their student, that can be a great start. Of course, parent and family engagement staff would be important to include in this, but even thinking about just going to present at a staff meeting once a year to other departments like athletics, residence life, student conduct, academic advising, student accessibility, even career services. So just thinking of any place a parent would call as a potential partner in this work. And then there also could be opportunities that are a little bit more in your wheelhouse. So if you don't currently have a parental notification policy, you could explore that. It's definitely an evidence-based strategy. If you do already have one, perhaps you could just take a look at your communications that go out to parents. Now, knowing that parents really liked kind of like a script format, maybe you could provide them with content when that notification goes out, some ways to unpack what happened so they can have a productive conversation with their student. So hopefully beyond orientation, there's a lot of different avenues you feel you could take. And then, not every campus I know has a parent engagement office, and it's not always an institutional priority. So I definitely would just encourage you to engage with administrators on a lot of the data that show a very clear return on investment of parental and family involvement. If substance use prevention isn't the selling point, there's certainly a lot of data around retention and academic success that can be convincing. And there's also likely informal routes to connect with parents too. So there might be parent-led councils or just smaller pockets of parents that you could tap into, like those in athletics or Greek life. And then those in advancement and development, even alumni relations, do typically also have some contact with parents. So just start anywhere, knowing that they're such an influential audience. It's likely to be a good move. And then just before we get to some questions, I wanted to talk about some further resources. So shameless plug to visit our College Parents Matter website, of course. And again, just encourage you to subscribe to our newsletter, and please feel free to promote it or the content or link to it on parent portals. It's pre-populated content that you can trust is evidence-based, and I know that can go a long way. SAMHSA also has the Talk They Hear You campaign, which is really great. It is a little bit more teen focused, but they have some great ideas and handouts and things like that. They also have a mobile app that has actually some role plays that parents can do with students. So I thought those are really great. They have an excellent podcast that I listened to. So definitely recommend that. And then AHEP, that organization I talked about, something that they specifically mentioned at their conference was that many of their memberships are not full, meaning that their campuses can carry up to 4 members as a membership to AHEP, but because a lot of parent engagement offices are small, they have 1 or 2 people, there's often more room. So, potentially that could be a bridge to reach out. And if you're able to be added to that, you can get access to their webinars and other resources that they share out. And then Campus ESP itself puts out a really interesting blog and some free webinars if you want to just keep up to date with kind of the trends in parent communication and kind of tailor what you're putting out there to meet what they are expecting and what they're engaging with. So those are just a few ideas for some further resources. But we hope that we can also be a resource to you. If you ever have any questions, please feel free to reach out to Malinda or I, or visit the Maryland Collaborative website. But with that, I think we're going to pause and take some questions. Stop share for now.
Excellent. Well, thank you both, Dr. Kennedy and Kelsey, for sharing of yourself and your expertise. We did just have a couple of questions that came in during the live session. And of course, if you have any questions, please feel free to drop them in the Q&A feature. So this one came in kind of towards the beginning, and they just said, once upon a time, many folks believe that, strict families may actually cause higher risk behavior in colleges for students who had experience with alcohol in high school. Do you think that the tides have shifted since that in the last 20 years?
Well, I would say that we hope the tides have shifted. I think there are still a lot of parents who might think that that's true, and either maybe trying to teach their students how to drink responsibly or not being strict is helpful to their student. But really, the research evidence doesn't support that at all. And really, those no alcohol messages give the students the lowest risk for drinking. And what some of the research seems to indicate is that when parents try to give those messages to try to teach them safely to drink, that the students don't hear it the way the parents intended, and they hear it as permissiveness and pro-alcohol messaging. And so I think we're moving in the right direction. I hope so that message is getting out there, that really the evidence doesn't support that, those pro-alcohol messages and the relaxation around student drinking. I hope that we're moving in the right direction. We're trying.
And I just wanted to add to you that, in the scripts that we have on the website, they're not formatted in a way where it's extremely punitive or, I don't know, they're formatted to be very open-ended. So it's just still discussion. So even if parents aren't being permissive, they're still there as a support, and they're intended to be structured as a way for parents to still express that, if they do make a different choice, that they're there and want to talk about it. So just because it's not permissive doesn't mean it's not caring or empathetic in some way. Yeah.
Definitely.
Excellent, thank you. We have another question. Do you feel that the percentage of parents that have their students' ID and password is on the too much of the Goldilocks scale, or is that something we as higher educators should be encouraging?
I would say it's probably a little bit on the too much scale. I think that falls in the we want students to build a sense of autonomy category. And so I think when that is happening, that sometimes students feel less like they're in the driver's seat, and that their parents are kind of still driving the ship in some way. So we really encourage support and check-ins, but not necessarily kind of doing for, if that makes sense. But I don't know, Malinda, if you had anything to add.
I agree with you, Kelsey.
Excellent. Well, again, I just want to say thank you both for, sharing of all of your expertise and your work and all of the amazing resources with our audience. I am just going to share a couple of housekeeping slides before we close today. Again, just a reminder of a couple upcoming events. We have the second session in our Learning Collaborative session taking place March 6th. We have a water cooler chat around strategies for promoting safe prescription medication practices happening on March 12th. Our next free webinar will be taking place March 27th and is around harm reduction in the collegiate setting, implementing practical evidence-based programs and policies. And then a final reminder that the 2024 National Meeting registration is now open. And with that, today's session has been recorded. So I did just want to remind folks that you can find the recording within about 5 business days uploaded to our website. Thank you again, everybody, and we hope to see you at another virtual event. Take care all.